Hi, I'm Dr. Timothy Burns, Medical Oncology in the Mayo Clinic Health System. I chose to be an oncologist for a couple reasons. The big reason really is just the patient population is just amazing. These are people that are facing just really bad diseases and conditions and can be very vulnerable, and to be able to care for those people is such a privilege. It's really worth waking up every morning and coming into work. So I really feel honored and privileged to care for these people. Another reason is the field of oncology is rapidly growing. There's new treatments, new research happening on a daily basis. It's really an exciting time to be in oncology. We're getting better at what we're doing. We're curing more people. We're providing better care for more people. And so the research and the patients are just the main reasons why I decided to be an oncologist. What I like most about being an oncologist is the relationship I get to build with my patients. We're fortunate that we can see patients on a frequent basis coming in for treatments or checkups. And so you really get to know someone, and I really value that relationship that I build with my patients. I get to know them, I get to know their families, and it's just a really great part about my job. When I'm meeting a new patient, what I try and do to make them more comfortable is really just sit down and get to know them first, talk about their family, talk about where they're from, what their job is. It's a really scary time for our patients coming into a cancer center. There's a lot of emotions, there's a lot of fears and anxieties, and so trying to just get to know the person before we dive into all the details, I think really helps me as a provider get to know them and just sort of ease the anxiety a little bit of being a cancer patient. So my wife and I both grew up here in Wisconsin. We both grew up in Neenah, Wisconsin, the eastern part of the state. We have two sons. We live here in town, and our families are still here, and so we really enjoy spending time being back in the state and spending time with them, and just being back in the state that we grew up in. So what I like to do in my spare time, I like to spend time outdoors. We grew up in Wisconsin, so I enjoy spending time hiking, fishing, just getting outside in the summers on the water, in the winters on the snow with skiing and snowshoeing. I remember going up north to my family cabin in the summers, so we get to do that every once in a while, which is great. I enjoy watching sports, cheering for Wisconsin sports teams, and then just spending time with family and friends. Dr. Timothy Burns, Medical Oncology, Mayo Clinic Health System.